The Marty and Laura Show is brought to you by Veterinary Village. With locations throughout Wisconsin, Veterinary Village is dedicated to enhancing the quality of animal and human lives today and into the future. All right, you guys, welcome. Welcome to the Marty and Laura Show. I am your host, Laura Reeves, and I am joined again tonight by my best buddy, Dr. Marty Greer. I'm so excited that we're going to get to have a conversation with you guys again today. And this is sort of a listener request, something that I saw somebody talking about, asking questions about, and I really wanted to get Marty's input for all of our listeners. And the topic is Addison's disease and Cushing's disease. These are two basically diseases of the adrenal system. Am I correct, Marty?
That's correct.
And, the person who I saw talking about this was like, well, I bought my dog from a great breeder. And I'm like, well, that's nice, but there's no test to allow us to breed away from some of these diseases.
Yeah,
So,
they've worked on testing for standard poodles and Nova Scotia duck-tolling retrievers because there does appear to be a hereditary component to those.
okay.
But not all dogs that have Addison's or Cushing's are poodles.
Right.
Addison's is most common in poodles and Nova Scotia duck-tolling retrievers, but it happens absolutely in other breeds as well.
Every breed.
And I personally had one of my own corgis out of my breeding program that had Addison's. And at the same time I had her, I also had rescued a corgi that had Cushing's disease and diabetes. So I had two dogs living in the same house under my roof from two different breeding programs that had complete opposite ends of the spectrum. I was dealing with Addison's and Cushing's at the same time, and they're polar opposite.
Okay, yeah, that's what I was going to say. Let's walk through them. Let's start with Addison's, what it is, what it isn't, and then compare and contrast with Cushing's, because they are very different diseases, even though they affect the same body system, right?
Right. So let's start with anatomy. The adrenal gland is a tiny little gland above the kidney. The kidney is renal, so this is adrenal. It's right above the kidney. They're little bean-shaped, little tiny glands right above the kidney. Dogs have them, cats have them, humans have them. We all came equipped with them. So the adrenal gland has to function by producing mineralocorticoids and glucocorticoids. Those are the two jobs of the adrenal gland. So if it becomes hyperadrenocorticism or hyperactive, then that's Cushing's disease. I don't know who Dr. Cushing's was, but it was somebody. And then we have the opposite, hypoadrenocorticism, which again, somebody named Addison's named that.
Right.
And that's when the adrenal gland doesn't produce enough hormone. So we have polar opposites, hyper and hypoadrenocorticism, Cushing's and Addison's. I'm not quite sure why we kind of throw these terms around interchangeably, but they're essentially the same thing. I mean, the same hypoadrenocorticism and Addison's is the same thing, and hyperadrenocorticism and Cushing's are the same thing.
Okay.
So,
and so
you're looking things up, that helps you to.
That helps for sure. And I think it's a really interesting thing to talk about. Adrenaline does not necessarily come from the adrenal glands.
It does.
It does. Okay.
It does come from the adrenal gland.
That was the question.
Yes.
All right.
That is the glucocorticoid that your adrenal gland produces. So glucocorticoids affect your glucose levels and other types of things. Mineralocorticoids affect your electrolyte balance. So so there's two parts of the adrenal gland. So one controls one controls the other. And so when we have these things going on, that becomes the issue. So hypoadrenocorticism or Addison's disease usually means that you're not producing enough of both of those. You're not producing mineralocorticoids or glucocorticoids. Now, some dogs will only have a deficiency of one, but most dogs have both. So when we have a dog,
symptoms. So what do you see when you have a dog with Addison's versus a dog with Cushing's?
A dog with Addison's will have weakness, strawberry jam type diarrhea, and a slow heart rate, and they come in They are crashing and burning. They look like they've been hit by a car, but they weren't hit by a car. They go from normal to crashing and burning. And if you don't get blood work and electrolyte replacements and steroids into these dogs fairly quickly, you lose them. I mean, they can crash really fast. So
And that's
that is what
Cushing's.
that's Addison's.
That's Addison's. Okay. I was
Yes.
trying to make
And it
sure we got
typically is
this right.
right. Addison's. It typically is fairly rapid in onset. If you do blood work, you're going to see that the sodium and the potassium ratios are off. So the sodium potassium ratio should be above 22, up to 27 to 1. And if it's below that, then you have to be looking for Addison's. So there is a specific test for Addison's disease. Typically, we'll run a full blood panel like you would for any other dog that comes in,
Right.
CBC chemistry panel. You run that. Typically, the sodium and potassium are off. Sometimes the glucose is off. My personal dog, the day I diagnosed her with Addison's, I woke up on a Sunday morning to her having a seizure. I did blood work on her. Her glucose was 18. Her
Mm.
sodium potassium electrolyte imbalance was severe, and we very quickly had to get her on fluids, get her on steroids, get her addressed. And then there's a test that we do called an ACTH stimulation test to determine that she had Addison's disease.
Okay.
So ACTH stim, you give cortrosyn, you draw a blood sample, give cortrosyn, draw another blood sample, and then you see if the adrenal gland responded or not. And if it doesn't, then you have a diagnosis of Addison's disease.
Okay.
That's Addison's. The opposite is Cushing's disease. Cushing's is when the cortisol levels go higher and higher and higher in the dog's body. They're being produced in high levels, either by the adrenal gland or the pituitary gland. So we can see two kinds of Cushing's disease. We can see pituitary dependent and adrenal dependent. So it can be caused by an adrenal tumor, it can be caused by a pituitary tumor, or it can just be that the gland is not got an actual tumor, but it's just overproducing. And those dogs tend to have a very gradual, slow onset of their disease.
Mm.
They slowly get more and more likely to drink a lot of water, slowly drink more and more water, therefore they drink and urinate more frequently. They become pot-bellied, their skin becomes really thin on their belly. You can like see their blood vessels through their skin.
Mm.
And their blood work shows a very, very high alkaline phosphatase level. Some of those dogs, maybe I've seen 2 or 3 in my career, also have what's called calcinosis cutis, which is when there's calcium deposits that form in the skin, and they come in with these weird calcium deposits, really strange things, and the
Mm.
skin looks terrible, and the dogs look terrible. They look pot-bellied. They're they're typically drinking buckets of water and therefore urinating buckets.
Mhm.
So a typical dog with Cushing's disease is going to come in, and over the last maybe 6 to 12 months, they've sort of gradually seen these changes happen. Addison's happens overnight.
Got it.
Cushing's takes a year sometimes to develop, and the test we have for Cushing's is not as sensitive as we'd like it to be. It may
Mm.
be sensitive 70% of the time, so we may think that a dog has Cushing's, and in that case, we do a low-dose dexamethasone suppression test, meaning we draw a blood sample, we give dexamethasone, a steroid, by injection. Another 6 and 8 hours later, we draw another blood sample, and then we see that the adrenal function it'll tell us the adrenal function based on that test. So again, completely different tests, completely different diseases at opposite ends of the spectrum, but all affecting the adrenal glands.
Got it. And your slow onset, your Cushing's, right? That they just drink more, pee more, drink more, pee more, drink more, pee more. So if I'm someone who has a dog that's doing that and I bring the dog to the veterinarian, what are your differentials versus like diabetes or, some of the other things that cause some of those similar kind of symptoms?
Right. So absolutely diabetes can cause them to drink a lot, urinate a lot. And a dog with unmanaged, undiagnosed Cushing's disease can become diabetic.
Mm.
So then you have two diseases to deal with. You have to deal with the Cushing's and with the diabetes, which is what the corgi that I ended up rescuing had. Is
Mm.
I walked in to pick him up at a vet clinic because the people had said we're out. So I went to pick him up and I looked at him from across the lobby and thought, oh yeah, you got Cushing's and diabetes. Great. I
Mm.
got two things to manage.
Neato.
So yes. So we manage Cushing's disease typically now with a drug called trilostane or Vetoryl. It's an oral medication. We give it once a day, and it helps to suppress the adrenal or pituitary function to the point that the dog is more normal.
Mm,
Back in the old days, when I started practice, we used to have to use a different drug called mitotane or ODDD, and that was a lot trickier to manage because
mm,
you would have to put the dogs on enough drug to damage the adrenal gland to the point that it became normal. But if you
mm.
gave it for one extra day, maybe one extra dose 12 hours apart,
Oh,
you
wow.
could then crash the dog and push them into Addison's. So managing Cushing's disease is much better now than it used to be, but it's still not great. So it's still a little tricky to manage both Addison's and Cushing's disease. So Cushing's disease typically requires medication on a daily basis or twice a day basis, depending on the dog, to suppress their adrenal function back to normal. Addison's disease, on the other hand, typically requires replacing both mineralocorticoids and glucocorticoids. Glucocorticoids are prednisone. So we give prednisone as this tiny, itty bitty little
Mm,
wee dose
mm,
that just makes it physiologic. So it's not the same big dose that you use for allergies or autoimmune diseases or some of those. It's this
mm.
little tiny wee dose and something to replace the mineralocorticoids, which can either be a pill that you give twice a day, fludrocortisone, or we give an injection that lasts 25 days. And that's either one of two drugs, Percortin or Zycor, Zy, can't remember. So it's one of those two drugs. So we give those as an injection every 25 days, but prednisone every day.
Okay.
So those are the things that we do to manage these guys. They're complete opposite, completely different things. Now, the other thing that's kind of interesting, and I don't want to get too far off topic, but there is an adrenal function issue in ferrets, really commonly in ferrets.
Mm.
So if
Fair.
anybody has a ferret, yeah, and I know ferrets sound like they're off
Mm.
topic, but this
No,
is all part of our
no, yeah.
our
All our
pet
creatures, great
stuff
and
that we
small.
talk about. Right. So ferrets very frequently develop adrenal gland disease, probably because every ferret on the planet in the United States, well, every ferret in the U.S. that's kept as a pet is spayed or neutered when they're itty bitty babies.
Oh,
So it's thought that that probably influences their development of um, adrenal gland disease, and it's not the same as we see in dogs. So I don't want to in any way imply that ferret's disease is the same as what we see in dogs. And interestingly, cats, we typically don't see any adrenal gland disease. Well, there's a very rare case of a cat that develops adrenal gland disease. Is it possible? Yeah, but it's really really rare in cats. I've never diagnosed one, even though we know that it can occur. I have never diagnosed one, and typically those cats, and this is kind of weird, those cats will come in with an oversized head. They start to their skull starts to grow bigger. Um,
whoa.
so yeah, it's really weird. Um, so if Zycortal is the name of the medication that I couldn't think of, Zycortal. So if you have a cat that seems like, and it's a neutered cat, and suddenly he's getting bigger and bigger and bigger head, you probably want to see your vet.
That's just, I'm sorry, that's gonna fall into the bizarro category. But
It is.
what
It's a
I,
zebra.
it's a zebra for sure. And so the inside joke there is if it looks like a horse and sounds like a horse and acts like a horse, but it's not a horse, it's a zebra.
Right.
And Marty's the person to diagnose the zebra diseases. She did it for me. So my
Yes.
question
So
then
so yes,
is
if you hear hoofbeats, you look for horses, not
right,
zebras. The
not
first thing you look
zebra.
for is the common disease, and then if you can't find a common disease and you can't fit everything into one diagnosis, then you look for the zebra. So that's sort of the the
The
slang term
cat
that we throw
with
around
the
in.
enlarged head.
Yeah.
Okay.
So if you have a
So
cat with a giant head, then you need to see your vet.
I'm
Well, I'm just saying.
100%.
And
I'm down
taking a
with that.
Yeah. So
I
Google it and print it off and take it into your vet so that they're like, oh yeah, it could be
oh
adrenal gland
yeah,
disease
giant
because
head.
it's rare. It's really rare.
Okay, that's just creepy and weird.
Doggett simplifies the puppy buying journey by connecting families with the perfect breed and responsible, health-verified breeders. They are the only breeder marketplace that verifies health clearances and responsible breeding practices. Through their personalized puppy matcher tool and matchmaker services, they educate and guide buyers every step of the way, ensuring a seamless process and a perfect match for their lifestyle. From initial breed consultation to introductions with top breeders, Doggett makes responsible puppy ownership easy and stress-free.
My question, though, you said that the ferrets are all neutered and that's what causes their adrenal-based diseases. Can we attribute that in dogs or not?
Not necessarily. We see Addisons in poodles, in some other breeds, and in the Nova Scotia Duck Tailing Retrievers, sometimes congenitally. Like they can already have this when they're 3 months old. So
Ew.
it is, again, really rare, but it can happen.
Mm.
And even though you are very careful with a breeding program, you can have that happen. My particular corgi was out of my breeding program. I produced one of her. She'd already had 2 litters when it happened.
Oh,
She
wow.
never produced it. None of my other dogs in my entire line, 30 years later, have had Addisons. So yeah, no.
What What's our age
So
of onset for these two diseases, Cushing's and
Cushing's
Addison?
is a middle-aged to older dog disease, almost always in females. Addison's can be a lot more variable than that.
Mm,
I've seen it in mixed breed dogs. I've seen it in, just a number of different breeds. But if you have a poodle that's a poodle, standard poodle, miniature poodle, whatever it is, and it's got symptoms of
mm,
waxing and waning, not feeling well, up and
mm,
down, vomiting, diarrhea, and then it's better, and then it's not, and it has bloody
mm,
stool, and then one day it just crashes and burns, you probably have Addison's. So
mm,
so yeah, and it can happen at any age. Usually it's middle-aged, but I have seen it in congenital cases where
mm.
very young dogs have had it. So, over the years, I've seen a few of them in very young dogs.
Manageable, both of them, yes, if caught
Yeah, but
at a
but
reasonable
tricky.
time, but tricky.
But
Okay.
tricky to manage. They both require pretty careful management, frequent rechecks, a lot of blood work. The
Mm,
meds on both of them are kind of expensive. So,
mm,
yeah, it's not a disease that you really want to have because even though
mm.
it's manageable, it takes you and your veterinarian will become very good
Really
friends.
best buddies. Okay. Um, Prognosis long term if you manage it well.
Generally pretty good, but either of them can have acute
Mm,
exacerbations of the disease. My corgi died acutely, no explanation. She was well managed. I did everything the way you were supposed to. Every 25 days, got her injections. She was on the
mm,
mineralocorticoid, glucocorticoid, all the stuff. Cushing's disease, again, tends to be a slow, gradual, and
mm.
insidious onset. And typically, unless it's a tumor in the pituitary or the adrenal gland, they don't usually die from it. But it's hard to manage them. Dogs that urinate
Right.
buckets they're
Yeah.
hard to live with.
Yeah.
Frankly, they're just hard to live with, not on purpose, but
No, no, I've
they just
been
are.
there,
And
done
that
that
and
with
yeah.
various situations.
And then there's the other zebra that I just think we need to throw out there,
Okay.
and that's the pheochromocytoma. I know, don't you love that word? Pheo,
Okay, now you're
P-H-E-O.
gonna like blow up my brain again.
I know, it's my goal every week to do that. So
See
it's an
my
adrenal
eyes
gland
like
tumor.
not even the same size, you know?
So there's pheochromocytomas, and these dogs have storms. They have a storm of their adrenal function. They'll have these really weird ups and downs. Again, hard to diagnose, not common. It's typically diagnosed with an ultrasound looking at the adrenal glands. And I'm reasonably good with ultrasound, but for me to say reliably I can always find an adrenal gland on an ultrasound is not true. They are tricky to find. So if you go to a regular vet and they can
Mm,
do ultrasounds and find bladder stones and
mm,
find kidney problems
mm,
and look at livers and spleens and all that stuff, they're probably really good at it, but it may require either a specially trained veterinarian or a technician that's specially trained or
mm.
somebody that's very skilled at ultrasound to find the adrenal glands. Just saying. So if your regular vet misses it, their adrenal glands are they're the size of a pencil eraser, and on ultrasound that
Yeah,
is not easy to
that's
find.
not easy to find. So when you talk about these adrenal storms, what
Mhm.
does that actually look like? Is that seizures? Like you talked about seizures with Addison's.
If they're hypoglycemic, low glucose, yes, they will seize. They just have these really weird highs. They get really funky and weird. And so if your dog is having these strange episodes and it's not a seizure, grab your phone, get some video, and then contact your veterinarian. And again, you know, look up what a FEO is. They're rare. I've seen maybe two or three in my career. So they're
Mhm.
not something. If your vet says 3 times a week they find a pheochromocytoma, they're misdiagnosing something,
Right.
unless they are an adrenal gland specialist. That's a different conversation. But typically, you're just going to see these really weird things. So grab your phone, get some video, go to your vet, get some blood work, and expect that you're going to spend a little money getting the diagnostics done because they can be really tricky to chase down.
Yeah, I would think. And so you're saying weird, like hyper, right? The adrenaline
Yeah,
piece.
yeah,
Interesting.
yeah.
Interesting. Okay. So, we've got the distinction between the two, the opposite ends of the spectrum,
Yeah.
Cushing's and Addison's. Um, the comparison with Cushing's to diabetes, and it's not, right? We did that.
Well, they are related. If your dog is unmanaged, undiagnosed, and unmanaged with Cushing's, they may also become diabetic.
Okay. So make that connection. Um, anything else in the what my vet used to like to tell me, the PUPD, the pee too much, drink too much category, that could
Mhm.
also be mistaken for either diabetes or Cushing's?
Kidney disease.
Hmm.
And kidney disease comes in many versions. There's actually something, this is kind of cool. There is underdevelopment and almost, if either it's already happened or it's very close to happening,
Mm.
a specialty in internal medicine for veterinarians on renal specialists, kidney
Oh, wow.
specialists.
For real?
So we've had internists for a long time, and they do
Right,
hearts and livers and
right, right,
adrenal glands, and they do all the inside parts. But
right.
there is now going to be a specialty for people who are board certified in renal veterinary medicine. I'm very excited about that. So kidney disease can make them drink more, urinate more. It can be chronic, low grade, aging disease. It can be an acute infection, a bacterial infection in the kidneys. It can be leptospirosis. There's a lot of reasons that dogs can end up with kidney disease. And this is kind of funny. The PUPD is polyuric
Right.
polydipsic. That's
That's
the
all I just
veterinary and
remember my Dr. Robin
right.
telling me all the time. PUPD.
Right. And I was at a lecture about probably 2 years ago, and the veterinarian was speaking was from England. It was a very cool presentation because they did them at a movie theater all over the country. They piled a bunch of veterinarians in different movie theaters in big cities,
Oh,
and
wow.
this veterinarian in England was speaking to us about this
Crazy.
particular syndrome. And he said it's not PUPD, which is what we've always said PUPD. It's PDPU because you have to drink more before you urinate more. So polydipsic means you're poly meaning more, meaning you're polydipsic, meaning you're drinking more, polyuric, meaning you're urinating more. So the shorthand for that in human medicine and veterinary medicine is PUPD, but he said it really should be PDPU. So anyway,
Don't
that's
mess
just kind
with
of a
my
fun
brain,
little,
Marty. I've
it's
got.
it's just reverse it. You'll be fine. So kidney disease can come in many different versions. It can be acute, it can be chronic, it can be lepto, it can be all these different things. I actually just had a really interesting case in the last 2 months that I had a client that came in. She's just came in for routine wellness, and she has this cute little 2-year-old, fluffy little dog. This cute little dog. And she said, she's just started to urinate a lot. And I said, okay, well, let's check this out. Did some blood work and went, oh no, her BUN and creatinine and her SDMA, they're all high. This is not a good thing. Had her
Oh,
come back, checked her urine, did a bunch of stuff, texted her for lepto, did a bunch of diagnostics, put her on antibiotics. She came back in last week for a recheck, and she's normal. Like, dogs typically, when they go into kidney failure, it's
yeah,
a rapid downhill
yeah,
decline, and
right.
they are typically out the door within weeks. Cats will live for years with kidney disease. Dogs will live for weeks. And for her to make this wonderful recovery, I called her and I'm like, oh my gosh, I can't even believe I have such great news to tell you.
So,
Her kidney function returned to normal. But if she hadn't come in early, and talk to us about it and let us run the tests.
Done the preventative medicine. We've talked about this, you guys.
Yep.
And so would that have been like a kidney infection? And how do you get a kidney infection in dogs?
Well, kidney infections in dogs and cats are pretty rare. They're rare in people too.
Yeah.
But they're typically an ascending infection. Starts off as a bladder infection, and then the bacteria go up the ureters and into the kidneys and set up housekeeping there, causing pyelonephritis. And those are not common in dogs and cats. A lot of people come in and say, my dog has a kidney infection. They really mean a bladder infection.
Right.
And yes, there is a distinction. It's all part of the urinary tract system, but it's a definite distinction. So if anything is changing about your dog's water consumption or your cat's water consumption, you're seeing big puddles or big clumps in your litter box, the dog's asking to go out a lot or having accidents on the floor. If any of those things happen, go in and get it checked out. We have lots of really great things that we can do diagnostically now. And if you're interested in reading about this stuff, there is now the IRIS website, which is the International Renal Information Service. So IRIS has a whole website. They've got a whole thing for veterinarians, a whole thing for clients. So if your dog or cat is diagnosed with kidney disease, go to the International Renal website, and it goes through the stages and the different treatments and the diagnostics. So you can educate yourself about this and go in with some knowledge, and it helps you understand why we add certain drugs and certain diet changes along the way.
And we've done a little bit on kidneys in the past, but I just wanted to kind of make sure we were clear that you can have X, Y, and Z symptoms, and it can be A, B, and C different things. And you, the veterinarian, has to run the appropriate diagnostic test to determine which one of the various bodily functions is being adversely impacted by some bad thing.
Right.
That's my layman's explanation of the whole doodad.
Yeah, it's not as easy as just saying, well, let's just do a blood sample. It may be a number of different tests. It may involve imaging. So there's a lot of things that are going on. Can dogs and cats get kidney stones? They do, but again, not commonly. Most of them are bladder stones, not kidney stones. So it's just important to understand that there are differences, and your veterinarian isn't trying to rack up a big bill or, just jack you around. They are really genuinely trying to get you an answer, because without the right diagnostic tools and the right diagnosis, we can't treat the disease
do the
correctly.
right treatment. Right. And some of them are easily treated and some of them are less easily treated. So, and have better and worse outcomes. So,
And we hope for the best.
Exactly. Important stuff, you guys. Pay attention to how much water your dog drinks and how often it goes outside to go pee-pee. it has bearing.
And if it changes, let your veterinarian know. If you have to keep the toilet seat down because the dog uses that as a drinking fountain, then be aware something's wrong. So go in.
I have a thing about toilet drinking. My dogs, there's no toilet seat up in my entire house because Spinoni think it's pretty hysterical to just go dip their beards in the toilet and then smush them off on the toilet seat. And if you're not paying really close attention, it's a very unpleasant experience to go in the middle of the night and use the bathroom. So I'm saying.
But sometimes some of the dogs are smart enough that they've learned to flip the toilet seat up and use it anyway. So some people have to strap it down with a Velcro strap.
God. So it's not that bad at my house, thank God.
Yes, you just
have to hide all the garbage cans.
Spinoni.
No, I do not want a smarter Spinoni. No, thank you. I like Spinoni because they're not as smart as the wire hairs. It's okay. It's all right.
Yeah, there's something to be said for that.
100%, man. Give me a big, dumb, and happy. I love it. Marty, you have had a super long day. We appreciate your time tremendously. My suggestion
is be here.
Go get yourself something to eat and have yourself a happy, happy holiday.
Thank you. You as well.
All right. Thanks. Thank you for joining us on the Marty and Laura Show. We're excited to bring you these unique, fun, fact-based conversations about pet health. We hope you'll join us on social. Stop by the website to sign up for an extra tip of the week for your pet. While you're at it, do us a favor, please, and leave a review wherever you find your podcasts. The Marty and Laura Show is produced by Pure Dog Talk, Inc. Sound design and editing by Premium Audio Services.